So hi everyone. First of all, I just want to say a big thank you to Joe and Vina for inviting me here today to talk about my role and what I do. So I work at University College Hospital in London. So just as an introduction, I got this role in June 2019, and I'd actually worked at the radiotherapy department for 7 years before that as a senior radiographer. So I dealt a lot with sarcoma patients throughout that pathway as well. Currently, I'm still the only dedicated sarcoma radiographer in the country, so I am the only one who does this role currently in the UK. And over the last 3.5 years, I've key worked over 450 sarcoma patients, all adults over 20 years old, and they've all been having radiotherapy either radically or high-dose palliatively. And this role has grown from a completely blank canvas because there wasn't a description for it before, and I've made it to include multiple clinical, technical, educational, and research aspects as well. And importantly to me, and I think to everybody in here, the patient feedback has also shown a large positive change in the treatment pathway for the sarcoma patients themselves. So I did some work on just the patient breakdown for the first 2 years of my role, and found that I key worked 281 patients. Now, obviously, the main majority of these patients were soft tissue sarcoma patients, but I actually treated 47 patients with a primary bone tumor diagnosis. So that was 17%, and of those, as you can see, they were made up of chordoma, chondrosarcoma, Ewing sarcoma, and osteosarcoma patients. The majority of the above patients had radiotherapy either pre-operatively or post-operatively, and some also had it as a definitive treatment. So their treatment times varied from 5 weeks up to about 7.5, 8 weeks as well. So clinical aspects, so the majority of my sort of day-to-day working is that I key work all these patients from their consent appointment with their clinical oncologist all the way through to 4 weeks post their radiotherapy follow-up. And sometimes for these patients, it's beyond that. I sometimes still get calls and texts from patients 2.5 years after I've treated them, just if they've still got any questions. I review all these patients on treatment at least once a week. So on average, I see about 25 patients weekly, just to see how they're doing, and that ranges from week 1 all the way up to week 8. I also put a 2-week post-treatment telephone follow-up clinic into the pathway. Just from my own experiences of patients, I found that once they leave the radiotherapy department, especially if it's the end of their treatment, they felt like they didn't have anybody there. So me calling them after 2 weeks really helped with them still feeling that there was somebody at the end of the phone that they could contact if they needed to. I also signpost patients towards Macmillan Cancer Centre, where there's additional information, also therapy such as complementary therapy, financial assistance to help them through their journey as well. And I'm also a supportive information and for just carers and family members. So the technical aspects, so I attend all the required MDT meetings so that I can know about the patients prior to when they start their radiotherapy. I assess patients with the clinical oncologist when I consent them so that I can look at how best to use my knowledge and skills to make sure that their treatment setup is good and stable for the entirety of their treatment. I attend on set with sort of my knowledge to aid the treatment radiographer, so if there is an issue, that gets sorted out quite quickly, which has reduced the amount of replans that we've had to do. And I assess all on-treatment images. So we take weekly cone beam CTs, which are sort of mini snapshots of the treatment area, just so we can see if the tumours have shrunk, if they've grown, if there's any other changes that we need to assess. And then I also, as I said, initiate the replan pathway should this be required. So educational aspects as well. So I'm currently completing my second master's, which is in advanced clinical practice, which will give me skills to be able to prescribe and also to do advanced clinical assessments of patients as well. I'm here today, obviously I've travelled up on the train yesterday, so I'm trying to promote this role to other healthcare professionals and also to other sarcoma centres and patients as well, just to say that there is a benefit to having this in place. I deliver presentations on the sarcoma pathway to not only City University students now, but to other radiotherapy students to try and increase awareness in the student group of sarcoma, as outside of sarcoma specialist centres, students probably won't really see a sarcoma patient normally, so they need to understand the complexities of this disease. I deliver in-house image review training, so just looking at the skill sets that I've picked up so that the junior radiographers who come understand when they should call me and when they shouldn't. And again, immobilization and technique training to other radiographers and also clinical oncology registrars. So again, trying to train up the junior doctors to understand better how the sarcoma pathway works and what they need to look out for when they become consultants. And again, I've provided some training to other sarcoma radiotherapy centres who treat a lot less than I do. So research aspects, so I do annual departmental audits focused on the sarcoma pathway. I've completed a business case recently to initiate sarcoma prehab sessions. So this is quite important to me because I know from feedback from the patients and sitting here with you guys how important it is that you get the chance to meet each other. And even though I treat a lot of sarcoma patients, it's still a very rare diagnosis. So actually getting these patients together at the start of their treatment means that they will have somebody who can support them through the process. I've also, in a sideline to what I usually do, I publish work on TYA, radiotherapy open evenings, and I've got ongoing audits into the new proton beam therapy patient pathways, of which I might get a micropig now, because I think that would be really helpful if Jacksonville have got one. And I've got, there's an ongoing collaboration with the other specialist radiographers who work at University College Hospital as well. So technical improvements since I've been in post. So there's now improved sarcoma awareness amongst junior radiographers and radiotherapy students. There's a superior radiotherapy treatment setup troubleshooting, enhanced communication between the teams. So I work as a midpoint between a lot of the different teams in the hospital to get patients the best outcomes and reduce patient replan rates. And then patient feedback. So I've run some, as I said, I do annual audits where I've looked at what patients think I'm doing well and what I could do better. And in the last one, 100% of the patients felt fully prepared for their radiotherapy treatment. 100% of the patients felt supported through the treatment pathway. 100% of patients knew who their key worker was and how to contact me. And 96% of patients found the 2-week telephone follow-up that I put in place useful. So these are just some of the comments that I got back. I'm not going to read them all out to you, but I think it just goes to show that the patients really appreciated having a key worker in place and having somebody who they could ask their questions to, who would give them an answer that they understood came from my knowledge of their pathways and their side effects as well. So future work, so obviously as I'm completing the Masters now, which will mean that once I can do the prescribing skills, that will save some time and it'll make my clinics more efficient. I'm continuing to work on radiotherapy and PBT patient pathways. I'm now doing a competency so that I can actually consent patients for radiotherapy. I'm going to start the prehab sessions hopefully next year, and then continue to try and promote my role to other radiotherapy centres and to just other conferences to see that there is a need of a specialist radiographer, especially in sarcoma. And yeah, any questions then please let me know.